Hello, everyone. Welcome back. Last time we talked about the gluteal muscles, and this time we're going to be talking about the thigh muscles. So let's get started. And before we talk about the thigh muscles, let's actually talk a little bit about the compartments of the thigh, as well as the gluteal region. So just like last time, let's introduce the fascia, which will be superficial and deep fascia. So just like upper extremities, superficial fascia will mostly include fat, the blood vessels, the skin, the lymphatic vessels, the nervous tissue, everything that you'd find in the skin. But the deep fascia is going to be the fascia that covers the muscles directly. So looking down here, you can see muscle as well as deep fascia right along it. And this is going to be surrounding basically all of the muscles, as well as keeping like the muscles, blood vessels, and nerves within it, but then also compartmentalizing it into its different regions as well. So it kind of like keeps everything together, but there are individual muscles that will be able to do its own thing using like its own coverings called perimysium as well. Now, when you look at the deep fascia, like you can see it here basically encapsulating all of the muscles, but there are a few things that do come out, such as this opening called the saphenous opening, which has the great saphenous vein kind of like exiting here. So most of everything is going to be found within the deep fascia, except for like the skin and everything. But the muscles, the deep nerves and deep blood vessels will be found within. Now, something that you might hear like as we're going through this is the word fascia lata. That's referring to basically this deep fascia that covers the lower extremity. And just to be clear, when I say lower extremity, I really do mean lower extremity going from the like hip region all the way down to the foot. Now, when you look at these different regions, you can see that you have the gluteal region, which we talked about last time, but now the thigh region as well. But to just cover this really quickly, like the gluteal region, it has the superficial and deep compartments. That will be the parts that, well, the superficial is basically the big muscles, gluteus maximus, medius, and minimus. And then the deep compartment is going to be the parts with the small muscles, such as piriformis, obturator internus, superior and inferior gemellus, and then quadratus femoris. Now, the thigh region is going to have a few different regions as well, which we'll talk about later. So let's just keep moving. But in general, it's anterior, medial, and posterior compartments. Now, the gluteal region is going to include the gluteal fascia, which is covering the entire gluteal part. But unfortunately, you can see that it's cut here. But it is supposed to be continuous over the gluteus maximus as well. But you can at least see some of it going to the gluteus medius over here, as well as the tensor fascia lata. Now, when we talk about the gluteal fascia, there is a couple specific regions to look out for. Over here, you can see there's a kind of thickened region, which is coming from the iliac crest. And this is going to attach to the iliotibial tract over here on the side of the leg and thigh, or sorry, on the side of the hip and thigh. So the gluteal aponeurosis is going to attach from the iliac crest to the IT band or iliotibial tract, which then allows for the gluteus maximus and tensor fascia lata to insert onto the iliotibial tract and then lead down to the leg. So going across the knee joint, it does allow the tensor fascia lata and gluteus maximus to affect the leg to an extent, but most of their actions will be at the hip. So remember, like it helps to allow them to extend the leg or keep the leg extended at least, but most of their actions will be at the hip. Now, on the anterior side of the hip, there's also another region called the iliac or inguinal region. And the word inguinal we'll hear at least a few times, and inguinal is going to indicate the groin region, but iliac hopefully also sounds familiar because that's one of your major coxal bones or bones of the coxal bones, this big region up here. So when you look at the iliac or inguinal region, there are a few things to look at. The first of which is the iliac fascia, which covers the iliacus over here. Psoas fascia, as it might suggest, covering the psoas major over here. And then obturator membrane is going to be Like it's something that we've talked about, and it also got brought up with the obturator muscles, but right here, there's a hole in the coxal bone called the obturator foramen. That hole is mostly covered by the obturator membrane. But if you look closely, there is a small opening here too, so keep that in mind for later. But this is the obturator membrane where you'll have obturator internus and externus attaching to it. Now, while we're still in the inguinal region, I would like to also introduce something called the inguinal ligament. So the inguinal ligament is going to be on the front of the thigh, or front of the hip rather, and you can see it attaching from the anterior superior iliac spine, and then go down to the front of the pelvis at the pubic tubercle. So the inguinal ligament is basically kind of the divide between the abdominal muscles or the oblique abdominal muscles, such as external and internal oblique, and then the hip or thigh region, which is going to be starting right here as you get down onto the femur. So this is an important structure that we'll look at later, but the inguinal ligament is right here. And while we're at it, you can see there's a small opening called the saphenous opening, kind of right underneath the inguinal ligament, which is where you can see a vein coming out, which we saw earlier, which is the great saphenous vein. And get used to hearing great saphenous vein because you'll see it quite a few times because it's going to be found in the thigh, as well as the leg, and then a little bit on the foot too. Now, looking at the fascia of the thigh, like it covers the thigh, like we talked about that, but it also forms the intermuscular septa. So keep in mind, similar to the humerus, the femur is the sole bone of the thigh in this region, but between or coming off of the femur and going between the muscles, between muscles, is the intermuscular septa. And there's 3 intermuscular septa. The medial intermuscular septum divides the quadriceps on the front and then the adductors on the medial side. So hold on, let's back up a sec. So the word adductor, where do you think the adductors will be? Like adductors that pull the thigh inward, like that is going to be on the medial side. So the medial intermuscular septum is going to be between the quadriceps on the front, and then on the medial side, you have the adductors. So right over here, I know, not the best example, but right over here between quadriceps on the front, adductors on the medial side, this is going to be medial intermuscular septum. But then you have the adductors here again. On the posterior side of the adductors, that's where you're going to have the posterior intermuscular septum. So posterior intermuscular septum is going to be between the adductors, and then on the back, the hamstrings group. So the hamstrings group is going to be the adductors in the hamstrings group will be divided by the posterior intermuscular septum, which means that on each side of the adductors, there's either medial or posterior. I know that naming is not the best, but those are the intermuscular septa along the sides of the adductors. But then on the lateral side, you have one septum that divides the hamstrings and the quadriceps. And that's going to be right over here on the side. And that's going to be the lateral intermuscular septum. Now, these septa are going to help with dividing up these thigh muscles, which will then be compartmentalized into muscles that mostly do the same action and mostly have the same innervation. So being muscles of the thigh, though, they do get a little bit diverse, or like there's a large variety of actions that some of them will do. So it's good to compartmentalize and group them together a little bit, but they won't all do the same thing usually. So let's go ahead and take a look at this. So in the thigh, you have the anterior, posterior, and medial compartments. The anterior compartment is mostly going to be leg extensors. So leg extensors, what does that mean? You extend the leg or extend like the knee joint. So when you straighten out the knee joint, you are extending the leg. And then the posterior compartment will flex the leg. And then the medial compartment, as we were talking about earlier, adducts the leg. Now, adduct makes sense. like we kind of talked about how the medial thigh muscles will be able to pull the thighs inward to adduct the thigh. Now, when we say the word flexor or extensor though, like we've been kind of practicing this with the upper extremity, but unfortunately, it's the opposite for the leg, the foot, and the toes. So when we talk about the leg, the anterior compartment is going to have muscles on the front of the thigh, which means that it connects to the front of the leg. So when these muscles contract, they pull and cause the leg to extend. But on the back of the thigh, attaching to the back of the leg, when these muscles contract, they will pull the leg and bend the knee to flex the leg instead, which will also be the same thing for like the toes. So when you extend your toes, you're using muscles on the anterior side of the leg and vice versa, but it's the opposite for the leg and the toes. But one last thing I should bring up is that the thigh is actually what we'd expect with being able to flex the thigh on the anterior side. But let's just stick with this for now. Now, when we look at the nerves or the innervations, this is also going to be kind of a organization that you can use like with the compartments, because for the most part, you'll see that there are certain nerves going to each compartment specifically. The anterior compartment will have the femoral nerve, so luckily that one is pretty consistent. The medial compartment will mostly be innervated by the obturator nerve with some kind of additions from the femoral nerve and tibial nerve. But then the posterior compartment is then going to be innervated by the tibial nerve with exceptions from the common fibular nerve. So this one wasn't quite as cleanly divided up, but at least anterior compartment, femoral nerve, medial compartment, mostly obturator nerve, and posterior compartment, mostly tibial nerve. Now that leads us down to our first compartment, which will be the anterior compartment. And these are all muscles on the anterior side of the thigh, which will include the sartorius, which goes across, the Articularis Genu, which you actually can't see here, which is kind of deep along the top of the knee. And then the quadriceps femoris is just a fancy word for saying quadriceps muscles or quadriceps group. So the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis are all part of the quadriceps femoris group of muscles. Now, when you say the word quad, like hopefully you can count to like how many nerves or how many muscles we just talked about. Like what does the word quad mean? 4. So quadriceps femoris has 4 muscles, which are 3 vastus and then 1 rectus femoris. Now, if you would like, you can see most of these muscles like located here, but you are missing the Articularis Genu down here, but you can see sartorius going across, as well as 3 muscles on each side, or sorry, 4 muscles, like kind of like all around the femur over here, vastus lateralis, medialis, intermedius, and then rectus femoris going all the way up and down here. Now, to get started, let's take a look at the sartorius. The sartorius, which is this long muscle going across the thigh. So hold on. So the long muscle going across the thigh, this is the sartorius. So the sartorius is basically like this long sash that goes across the thigh from the anterior superior iliac spine, so up at the hip joint, and then down the front of the thigh and across from lateral to medial to go to the medial side of the tibia. So this is kind of going diagonally, and it's in fact one of our longest muscles of the body, but it's also very complicated in its actions. So, well, not very complicated, but it just has a lot because it's going across 2 joints and it's going at a different angle, like for each side. So let's look at this. It is up here on the lateral side of the front of the thigh. So front of the thigh, it helps with hip flexion. Lateral side, it helps with hip external rotation. And then once again, lateral side, it helps with hip abduction as well. So lots of fun stuff at the hip, but it also goes across the knee joint. So if you look closely, it's attached kind of near the medial and posterior side of the knee over here. This helps with knee flexion as well as knee internal rotation. So being that it's on the medial side of the knee, it helps with internally rotating the knee, but also being slightly on the back, it helps with knee flexion as well. So this, in this case, is one of the really big instances where you want to look at the muscle, look at its attachments, and then also the angles that it's pulling, because I mean, there's 5 actions here, and it's going to help with doing a lot of different things for each joint. So this nerve, though, luckily, all of the anterior compartment will be innervated by femoral nerve L2, 3, and 4. So femoral nerve, roots L2, 3, and 4. Now, after sartorius, we lead to our big group of muscles, which is quadriceps femoris, which has 4 muscles, but our first one here is the kind of like biggest, longest one, the rectus femoris. So rectus femoris. Rectus, you'll hear a few times as well, but that means straight. Rectus femoris is the muscle that goes straight down the front of the thigh, and you can see that right here pretty superficially as well. But going to the same place as the sartorius, you can see that it is originating at the anterior superior iliac spine, and then it goes down across the knee joint, but it uses a specific tendon or ligament called the quadriceps tendon and the patellar ligament. So that is a talk for another time, but the rectus femoris and basically all of the muscles of the quadriceps tendon, or all of the muscles of the quadriceps, insert onto the quadriceps tendon, which then connects to the patellar ligament and goes to the tibia. So we'll talk about that later, but basically that attachment to the patellar ligament allows it to attach to the tibia across the knee joint, and it's attached to the front of the knee, so it helps with knee extension. But where did it originate again? It originated up here across the thigh. So just like sartorius, it helps with hip flexion as well. So it helps to do both hip flexion and knee extension. So I know, a little bit confusing, but the muscle on the front of the thigh will help with knee extension, but then hip flexion, as in like it flexes the joint between the thigh and the trunk, but that it helps with increasing the joint of the knee between the leg and the thigh. So this is going to be innervated once again, though, by femoral nerve L2, 3, and 4. Now that leads us to a few muscles that are kind of like grouped together, and they're going to be all basically surrounding the rectus femoris. So you have 3 different vastus muscles, and the first one that we have here is called the vastus medialis. So the vastus medialis, as its name suggests, is medial, and it's right over here on the medial side of the rectus femoris. So vastus medialis, like notice that this is the medial side because you can see the pubis bone or the like pubic region as well. But vastus medialis, this is going to go kind of along the back of the femur and the medial side of the femur to go to the intertrochanteric line up on the proximal side of the femur. It's going to go along the linea aspera along the back, and then it's also going to attach a little bit to the tendons of the adductor magnus and longus as well. So even the medial intermuscular septum will be in there as well, but it kind of like wraps around the back of the femur, and then it inserts. Once again, very luckily, the insertion is a lot more clear at the patellar ligament at the patella via the patellar ligament. Now, these muscles do not go across the thigh joint, so the only thing that they do is knee extension. But you actually do also have this other part of vastus medialis called Vastus Medialis Obliquus, which is going down to this part over here, which is a little bit more diagonal. So Vastus Medialis Obliquus will be down here, the kind of angled part of the vastus medialis. So the more longitudinal part is vastus medialis, but this part is vastus medialis obliquus, a little bit more distally. Now the vastus lateralis, as its name suggests, is on the lateral side to the rectus femoris, and you can see that right over here. And this is going to be basically the same thing. Like, it's going to be wrapping around the lateral and posterior side of the femur, but it's then going to insert at the patella, or sorry, the tibia via the patella ligament, and then it's going to help with knee extension. So knee extension is going to be straightening out the knee again, and once again, it's innervated by femoral nerve L2, 3, and 4. And then hopefully this kind of sounds familiar, but vastus intermedius is going to be kind of under rectus femoris. It's going to be between the vastus muscles. So between it is vastus intermedius, but it is going to be wrapping around the femur. It's going to be inserting onto the tibia via the patella ligament, and it's going to help with knee extension and innervated by femoral nerve L2, 3, and 4. So very similar, just the origin changes a bit, but very similar to the other vastus muscles. So you had vastus medialis, lateralis, and intermedius, which all do knee extension, and they're all innervated by femoral L2, 3, and 4, and they're even all inserting at the tibial tuberosity of the tibia via the patella ligament. Now the next muscle that we have here is the Articularis Genu. So this muscle you can see deep to the vastus intermedius, and it's not very big. It's just along the front of the femur. So the front distal part of the femur, right above the knee, this is where you have the Articularis Genu, where it's going to then insert not across the knee joint, but just to the synovial membrane inside of the knee joint. So this helps to kind of like pull on the synovial membrane whenever there is actions being performed by the knee joint, so that it keeps the synovial membrane somewhat out of the way. And then luckily, once again, femoral nerve L2, 3, and 4 is its innervation. Now, while we're here, there's a region that we want to look at, which is called the femoral triangle, which is going to be formed in the front of the thigh region by the sartorius, the inguinal ligament, and then one muscle which we'll talk about very soon called the adductor longus. So this triangle is called the femoral triangle, and this is actually something that is very easy to find, very helpful to find certain muscles, as well as blood vessels and nerves that travel through it. So this is going to be the femoral triangle formed by inguinal ligament, adductor longus, and sartorius. And then at the floor, iliacus, psoas major, like behind it. So you can see that here with iliopsoas, and then the pectineus right over here along like the back of the femoral triangle. So in here, this is where you'll find three major things: femoral artery, femoral vein, and femoral nerve. And usually they will be found in a certain order, which is NAV or NAV, nerve, artery, vein. And then technically there's other stuff there too, which includes empty space with lymphatics. So navel is actually the full one, but I usually at least try to remember NAV. Now, another thing that we'll see here that's relative to the inguinal ligament is the inguinal canal. So the inguinal canal is actually a space that travels through the inguinal ligament here, which, depending on whether you have testes or not, like there will be like a spermatic cord that goes through it. But at the very least, like everyone does have like, or uses the inguinal canal to help with allowing for some support of the reproductive organ. So for the men, like that's going to be where you have the spermatic cord that travels through here, which will have the gonadal blood vessels, as well as the vas deferens, which help with the passage of sperm, like to travel through here to get to the testes inside of the scrotum. But for women, it's going to have something called the round ligament, which will be a supportive structure that will connect the uterus to the pelvic wall. So the inguinal canal is going to be located kind of like along the internal pelvic region, but it's just something to look at while we're looking at the inguinal ligament right over here. So this is where you might have like the inguinal hernia, which is going to be like if you have an opening or whether you have something coming out from the inguinal canal in this region. So you can see two kind of openings here, at least for like if you have a spermatic cord, the spermatic cord will travel through here, which is where you have a superficial inguinal ring on the outside, a distal inguinal, or sorry, deep inguinal ring on the inside, and then the inguinal canal is the actual space traveling between them. And then while we're still looking at this, there are a couple of different blood vessels and nerves that we can see here traveling through two different compartments in this inside of this inguinal space. So behind the inguinal ligament, this is where you find like all of those things traveling down through into the femoral triangle. But there's actually a division of those two, which will include the vascular compartment, which vascular means blood vessel. So you see femoral artery, vein, as well as lymph nodes. And then you also have the muscular compartment, which is where you find the muscles that travel from the pelvic region down into the hip region or the thigh region. And that's where you have iliopsoas with iliacus and psoas major. So right back here, you can see the muscles, that's the muscular compartment. But then the vascular compartment, you can see here with femoral artery, vein, and then lymph nodes. Now, something that we're going to see in the dissection, though, is that there is kind of like this part that actually surrounds all of those blood vessels together. That's going to be called the femoral sheath, and that's going to be traveling down through, or that's going to be kind of surrounding everything, allowing them to travel through together, like through the, well, it's called the adductor canal. So we'll take a look at that later, but you can see the retroinguinal space, which has the muscular compartment in the very back, the vascular compartment somewhat more anteriorly, and as vascular and muscular indicate, like one is carrying the muscles and one carries the blood vessels. Now, when we talk about the femoral triangle, there is another thing that we can kind of bring up, which is that this is a very good place to find like these very large blood vessels. So the femoral artery and vein are somewhat superficial at least, which allows you to find your femoral pulse. So about 3 centimeters inferior or distal to the inguinal ligament. But this is also where a lot of catheters are going to be able to be inserted through. So like catheters as in like things that they'll need for like different types of surgery. Like you can use the femoral artery and vein to travel from femoral artery up to the aorta, or travel like through the vein to the inferior vena cava. So when you have things that require some effects on like large blood vessels of the heart, like you actually might be using the femoral artery and vein to do that. So these veins are veins and arteries are pretty big, and they would allow a pretty simple and somewhat continuous pathway to lead to like large blood vessels, even as far up to as the heart. Okay, so let's go ahead and take a look at our next region over here, which I think I actually wanted to talk about the medial part first. So hold on. Oh, forget it. Let's just talk about the posterior part. So the posterior compartment, that is going to actually only include 3 muscles. So you're going to have a single muscle with 2 heads, which is called the biceps femoris. And then you'll also have a pair of muscles, which are like one on top of the other, which is semimembranosus and semitendinosus. So biceps femoris. So just like we had a biceps in our arm, but that was biceps brachii, biceps femoris is a biceps muscle or two-headed muscle in the thigh instead. So biceps femoris, you can see over here on the lateral side with its short head attached to the femur, and then its long head attached to the pelvis. So biceps, two heads, and then a singular insertion over here on the side of the fibula. But then semitendinosus and semimembranosus are two muscles, basically one on top of the other. And semitendinosus is going to be the one on top, which is skinnier, and then semimembranosus is the one underneath, which is wider. So to start off with, biceps femoris. Now remember when you kept on saying the word biceps, that's it, like that's why you always say biceps brachii or biceps femoris. Like there are multiple biceps muscles, so indicating that is really important. So biceps femoris, you have two heads. You have a long head and a short head, and this one is a lot clearer to see, the long head and short head. Like long head goes all the way up to the pelvis. Short head goes basically just to the back of the femur. So really for the most part, you only see the long head, at least pretty clearly. But if you look very closely, there's a little bit of the short head that pokes out over here on the side as well. So long head, you can see going all the way up, like from the pelvis. So over here, like at the sacrotuberous ligament, as well as the ischial tuberosity, this is going to go down and insert over here onto the lateral side of the leg at the fibula. So long head goes across two joints. This is going to go across the the hip and the leg joint. So the long head is going to help with hip extension as well as knee flexion. And then being on the lateral side, it also helps with external rotation of the hip and leg as well. But then if you look closely, the short head, not as clear, but it only goes up to the side, or so the back of the femur. So coming down from the linea aspera, this is where it's going to connect to the back of the femur as well as on the lateral side, and then go down to the lateral side of the fibula again, in order for it to be able to, in this case, flex the leg or flex the knee. So the short head only helps with flexing and externally rotating the leg or knee, but the long head is going to be able to help with doing that for both the hip and the knee as well. So most of the muscles on the posterior compartment will be innervated by the tibial nerve, and in this case, roots L5, S1, 2, and 3. But then the short head is going to have some innervations by the common fibular nerve as well. So we'll talk about the fibula, but basically it's like the lateral bone of the leg. So common fibular nerve, like it's going to be located down here, where the short head is going to be innervated by roots L5, S1, and S2. So you can see a little bit more of the short head down here. So here's your long head, here's your short head, and then this is where you'd have that lateral intermuscular septum between biceps femoris and vastus lateralis, this whole muscle over here on the side of the anterior and lateral thigh. Now our next muscle that we have is called the semimembranosus. The semimembranosus and semitendinosus will be the two medial muscles of the thigh. So once again, here's biceps femoris on the lateral side. Semitendinosus and semimembranosus will be over here on the medial side. Now, just like the biceps femoris, it is going to originate up here at the ischial tuberosity, but then it's going to go down all the way like to the knee, to the medial side of the tibia. So the semimembranosus is going to go to the medial side of the tibia, and being that it goes across the hip and knee joint again, this is going to help with hip extension knee flexion, and then internal rotation of both knee and hip. So this one is like most of the muscles of the posterior compartment, where it's innervated by tibial nerve with roots L4, L5, and L4, L5, S1, and S2. Now, semitendinosus is actually right on top of semimembranosus. So yeah, this is a little bit hard to see, but while we're at it, let's look at semimembranosus as well. So semitendinosus is this muscle on top, while semimembranosus is this muscle underneath. So semitendinosus is this skinnier muscle, or this muscle with a skinnier long tendon, which is where semitendinosus gets its name. But luckily, it will share the same origin with biceps femoris and semimembranosus at the ischial tuberosity, and then it goes down and inserts onto the side, or the medial side of the tibia. So this is going to help with knee flexion, hip extension, and then internal rotation of both knee and hip. And then same innervation as before, as semimembranosus, that is going to be L4, L5, S1, and S2. So these muscles, these three muscles, are known as the hamstrings muscles. So when you say the word pull a hammy, like you're talking about one of these. Biceps femoris, remember, on the lateral side, and then a pair of muscles, semitendinosus and semimembranosus, on the medial side. So how could you tell that this is the lateral versus medial side? One way is to look at kind of like the orientation of the butt, but then also you can see that you have this really big iliotibial tract over here on the side of the thigh as well. Now to finish off our muscles of the thigh, let's take a look at the medial compartment with the adductors. Now the adductors are a little bit tricky, there's some small muscles in there, but adductors, remember, these are on the medial side because they help with adducting the thigh. But luckily, some of the names will be indicative of how you look at it, but you can also kind of use certain muscles and landmarks to orient yourself as well. So to start off with, you can see most of your adductors here with Pectineus over here, as well as adductor longus over here, and adductor brevis over here. So longus is longer, brevis is a little shorter. Gracilis is the really long one, going all the way down from the hip to the knee. And then the Adductor Magnus is actually a really big muscle, which is going to be going to both, the femur, or two regions of the femur, one at a more diagonal adductor angle, and then one at a more longitudinal, kind of longitudinal angle, which I guess is more along the kin to a hamstring. But then if you look closely, something that we talked about earlier, do you know what this is? Do you know what hole this is? The obturator foramen. And then is this on the outside or inside? So this is obturator externus. So you can see that you have a lot of different insertions and origins. Make sure that you look at them carefully, but we can circle back to this and talk about that later. Let's go ahead and keep on talking about our muscles. So the first muscle is actually the muscle that I use to kind of orient myself to the medial compartment, which is the gracilis. So the gracilis. Okay, so the gracilis, you can see over here, the gracilis is actually the long muscle of the thigh, which is going straight up and down, kind of like the medial side of the thigh. So hold on, let me just make sure. Okay, so here's at least a slightly better picture. So here's the gracilis. You can see the gracilis, which is going up and down the medial side of the thigh. And this is the muscle that I look for first. This muscle is going to be basically kind of like the divide between the anterior adductors and the posterior adductors. So the gracilis is usually a very easy muscle to find because it's 1, very long, 2, very straight, but it's also between the anterior and posterior sides. So the gracilis is going to go from the hip down across the hip joint and then even across the knee as well. So this is going to be originating near the pubic symphysis up here, and then it's going to go down across the hip joint, across the knee joint, and then inserting onto the medial side of the tibia again. So it's actually going to insert very close to where the semitendinosus as well as the sartorius are going to insert. So that's another thing to look for regarding the gracilis. Now, being that it goes across the hip and the thigh, this will help with hip adduction, as its like compartment suggests, being on the medial side, hip adduction, but also knee flexion and knee internal rotation. So it's attached on the medial side of the posterior leg. It's going to be helping with knee flexion and knee internal rotation. And for the most part, the medial compartment will be innervated by the obturator nerve, and in this case, roots L2, 3, and 4. Now, Pectineus, you might recall from like the femoral triangle, because this is one of the major muscles forming the floor, and you can see it as one of the most superior or proximal adductors of the thigh, and you can see it right over here. The pectineus muscle is this kind of like flat muscle right in the upper back portion of the femoral triangle. This pectineus muscle, it does have at least a landmark or a couple landmarks that are going to be named for it though, originating at the superior pubic ramus near the pubic tubercle, or between the pubic tubercle and the iliopectineal eminence. So near the iliopectineal eminence, that's where you'll find pectineus, but then along the femur, it will go down to the pectineal line, where it's going to be on the medial side of the proximal femur. So if you remember the linea aspera going along the back, kind of divides between medial and lateral, gluteal and pectineal, like, well, in this case, pectineal line. The pectineal line will be on the medial side. So that kind of aligns with pectineus, while gluteus is going to be inserting over there instead. So as its compartment is going to be organized, it's going to help with hip adduction, but it is going to also help with a little bit of hip flexion being somewhat anterior as well. So hip flexion, hip adduction, and then obturator nerve is going to be one of its major innervators or innervations, but then the femoral nerve also is going to be here as well. So obturator nerve as well as femoral nerve. Now adductor longus is our next adductor here, and if you look closely, directly under pectineus, you can see adductor longus. But then even again, another thing to look for is that gracilis is over here on the medial side. Adductor longus is right in front of it. So between pectineus and gracilis, that's where you find adductor longus. And adductor longus, like as its name suggests, is the longer of, well, a pair of adductors. So in this case, this is going to be somewhat on the anterior side of the thigh and right in front of the gracilis. But this is going to be originating near the pubis, near the pubic symphysis, and then it's going to insert onto the linea aspera. So it's going to insert onto the linea aspera, and when it contracts, it could do hip adduction again, hip flexion, and then also a little bit of hip internal rotation as well. So being on the medial side, it could pull the hip a little bit to rotate it internally. But as most adductors are innervated, obturator nerve, in this case, L2, 3, and 4. Now, adductor brevis is a muscle that is right underneath adductor longus. So if you look closely, you have to kind of like cut adductor longus, where then you can see adductor brevis right over here. So adductor brevis is underneath adductor longus, as well as Pectineus. Adductor brevis is going to be a slightly shorter adductor underneath adductor longus. So this is going to be along the inferior ramus of the pubis, but then it's going to go along the pectineal line and the linea aspera. So just like adductor longus, though, it helps with hip adduction, hip flexion, and hip internal rotation. And then also, like adductor longus, it is innervated by obturator nerve L2, 3, and 4. Now, adductor magnus is kind of the special one of the adductors because it's going to do a lot. But, well, not a lot, but like it does quite a bit because of its like different attachments. But adductor magnus is like, if you know what the word magnum means, like if there's any magnum size things that you know of, adductor magnus means big. So adductor longus, adductor brevis, and pectineus were all pretty small, short muscles for the most part. The only one that's somewhat comparable in length, at least, is the gracilis. But adductor magnus, like, to be honest, like you don't usually see a lot of adductor magnus. Like, here, let's see. Adductor magnus, you can see right over here. So here, let's bring this down and you can see the back of adductor magnus here. Adductor magnus, it doesn't look that big. Like you can only see a part of it though. Like gracilis is covering it, hamstrings are covering it. But when you cut all of that out, you can see adductor magnus is quite big. Like it's really like broad. It's going to go all the way down across the hip and then across the knee as well. But then it also is going to span out or like fan out and then connect to the side of the femur as well. So adductor magnus is pretty large and it's going to be connecting, or it's going to go across like multiple joints. So this is adductor magnus, same as this and this. So adductor magnus, big muscle, big adductor. And in this case, it's going to have two parts. So the adductor part, like this part is going to be originating at the inferior ramus as well as the ramus of the ischium. And then the posterior part is going to be originating at the ischial tuberosity. So these two parts are going to then insert onto either the side of the femur over here or down across the knee joint, like, hold on a sec. Sorry. It doesn't go across the knee joint, like it goes to the side of the thigh. Okay, so to back up, I got mixed up. Adductor magnus, you can see right here, it's going to go along the medial side of the thigh, or it's going to go onto the distal side of the thigh, which allows it to do two things: adduct the thigh or extend the thigh. So adduction is its big thing. Like either way, it's going to be adducting, just like all of the rest of the adductors. But the posterior fibers, or rather the hamstring part, is going to go all the way down to like the bottom of the femur. So it's going to be going to the adductor tubercle of the femur on the distal end. And this is going to help it to do hip extension. But in a weird way, it is also going to be kind of inserting slightly on the anterior side as well, which allows it to do some hip flexion too. So adductor magnus is a little bit of a weird one, but it's going to do hip extension, hip adduction, but then to some extent, hip flexion as well. But at the very least, remember that it's big, it's adductor magnus, and it's going to be innervated mostly by obturator nerve L2, 3, and 4, but then also the sciatic nerve L4, 5, and S1. So those were the muscles of the thigh, but to take a look at a few more things, you also can see a few different landmarks that we'll be able to use as well. So to start off with, you have the adductor canal. This is a space that's going to be mostly formed by the adductor magnus, but this is going to be where basically you have the femoral artery vein, as well as the saphenous nerve and branches of the femoral nerve traveling through. So you have the femoral nerve, femoral artery, and vein traveling through and down here through the adductor canal, which is going to be formed by the sartorius, the adductor longus, and then adductor magnus. So this right here will be where you have the adductor canal, which is where the where the femoral artery, vein, and nerve are going to travel through. But then the femoral artery and vein will continue to travel through the adductor hiatus. So notice here that we have cut the sartorius. The sartorius is cut, and you can see the femoral artery and vein located right here, traveling through this space formed by the adductor hiatus, formed by the adductor magnus. So the adductor magnus is going to form like a little opening. And if you look back at adductor magnus, you can see a space here formed by itself in the femur. This is where the femoral artery and vein will travel through. And then they actually come out along the posterior knee as the popliteal artery and vein. So the popliteal artery and vein come out along the posterior knee in the popliteal fossa. And popliteal, basically, if you haven't guessed, means back of the knee. So adductor canal is where they travel down along the front of the thigh. Adductor hiatus is where they travel through to go from anterior thigh to posterior knee. And then that's where they turn into popliteal, where they then travel and continue down to the leg. Now, lastly, you have the pes anserine tendon. And basically, this is kind of where like three tendons sort of join together. They don't necessarily fuse, but you can see that they all attach very close together, which is where you have the sartorius, the gracilis, and then the semitendinosus attaching. So pes anserine or pes anserinus, that means goose foot. So you take what you can get, but at the very least, it doesn't necessarily make it look like a foot, but you can see that this is also just a great thing to like take note of, because this will be really helpful to see where they're attaching, remembering where they're attaching, and then organizing the muscles that you have here. So that's about it for the muscles of the thigh. We'll take a look at the nerves next, but go ahead and take a break. I'm going to do the same, but thanks for listening. I'll see you all next time.